Assalamu alaikum. Good morning, everyone. We are going to start a new subject, pathology. It is also a branch of biology and most important field or most important subject to understand the changes in human body during any disease, during any infection, during any injury. So before starting this subject, I should introduce myself. I am Muhammad Toqueer. So I will teach you pathology, inshallah. We will try to understand pathology, and then first of all we will define pathology, and then we will discuss something from past of pathology, how pathology was discovered, and then how pathology is uh, involved in cellular level, involved at cellular level. How, what is actually, we will overview, we will summarize the feature of cell, of human cell or human cell, because you have already studied many basic things about cell, human cell, and you will learn many advanced things in physiology about cell, and so we will just introduce, or we will just summarize the components of cell or function of different cells, and then we will move toward this cell injury, and then we will try to understand the causes of cell injury, how cell injury occurs in human body, and what changes are associated with the cell injury, and then we will define some important terminologies, which mostly used in various chapters in pathology in our coming lectures. Then we will summarize this whole our today's lecture. So what is pathology? First of all, we have to understand it in very simple, but in very simple way, what is pathology? The scientific study of functional and structural changes in disease. It means many type of changes occur in human body during any disease, infection, or any abnormality. So what type of changes are first? These changes may be functional or structural changes, or at cellular level, and then at tissue level, and then at organ level. So changes, structural or functional changes, and the cause of these changes is actually pathology. So the scientific study of functional and structural changes in disease, during any disease in cell, this is actually pathology. And due to structural and functional changes in cell, tissue, or organ level, many symptoms appears. So we will try to understand symptoms on the basis, usually we try to understand any disease on the basis of symptoms, on the basis of on the basis of different signs. So this is pathology. So in short, pathology is actually a subject in which we will identify the scientific, we will study scientifically changes during any disease in our cell, and then in our tissue, and then at organ level, because cell is actually a basic unit. So if any change occurs in the cell, occurs in the at cellular level, then after a continuous exposure, tissue may become damaged, and after tissue damage, organ may face severe damage. So because cell and tissue and organs all are associated, all are actually associated with each other. So injury at any, even at cellular level, may can cause damage may can cause damage the tissue, in the tissue, or in the organ ultimately. So what are changes, and what are symptoms of any disease, and what happen during any disease in our body, in our cell? This is actually pathology. So in, like in different disease, like in diarrhea, there are different types of bacteria which actually they cause diarrhea in many different way. They usually in few bacteria, they increase cyclic AMP inside the cell, and due to increase in cyclic AMP, usually fluids move out of the cells, and it causes diarrhea. So there, this is pathology. What is going on inside the cell, and what is going on inside the tissue, and what happens with the organ? This is pathology. So we will deal with the changes in human cell, or human cell changes in specific cell during any disease, during any injury, or during any syndrome. This is pathology. So changes, scientific study of functional and structural changes. In very simple way, you should understand this term pathology. This is different from, slightly different from etiology, but pathology actually function and structural changes, study of functional and structural changes, because they usually it appears with symptoms. The science of causes and effects of disease, especially the branch of medicine that deals with the laboratory examination of samples of body tissue for diagnostic or forensic purposes. So, actually, how we can implement pathology in our medical sciences. So, what is pathology in our medical sciences? Pathology actually is a branch of medicine, and pathology is concerned with the diagnosis of different diseases. How we can diagnose in different diseases? First of all, we can identify clinically, but clinical examination is not pathology. Usually, sometimes many diseases appear clinically not significant, because usually no symptoms. In many chronic diseases, symptoms are much rare. But what is pathology? How pathology involved in our daily in our medical sciences? So actually, it's actually a testing. It's actually a pathology. The branch that deals with the laboratory examination. So what is pathology? Pathology is involved in the laboratory examination of samples, and samples may be examined microscopically or macroscopically. So, laboratory examination of body tissues for diagnostic or forensic purposes. Please keep in mind, it's actually a pathology in our daily life involved in the laboratory examination, or sometimes because, and we say usually, and you observe that hopefully you have observed that in most of at most of at the board of most of laboratories, it was written that pathology laboratory. It means actually it's actually a branch which deals with the testing of samples, and testing and samples may be any body tissue, and sample may be any body fluid, and sample may be any cell of the uh, body, any cell of the body. So study in the study at the sample to diagnose any disease, to report any changes in the body. It is actually pathology. It is actually a laboratory examination. Like, for example, in our body, normal hemoglobin concentration in actually a male is around 14 to 16 or 14 to 17 according to different guidelines. Usually is in our area is normal hemoglobin concentration in male is actually 14 to 16. But during anemia or during hypochromic microcytic anemia, we found much less hemoglobin in our blood. After laboratory examination or after complete blood count, we identify low concentration of hemoglobin, and then we diagnose its anemia. So this is laboratory examination, which is actually involved in change. So actually, we found hemoglobin change. We find concentration of change, concentration. We find low concentration of hemoglobin. So this is change, and this will lead toward the any diagnosis, not only hypochromic anemia or anemia. This will lead toward the any change will lead toward the diagnosis. So this is pathology. Hopefully you are able to understand the pathology is in very simple wording. In our daily routine, many different test laboratories, many different sorry many many laboratory examination is actually deals in under the flag of pathology. So how we perform laboratory examination? We perform laboratory examination many different ways, like like on body tissues, after surgical removal of tissue. And we can perform laboratory examination on blood or any body fluid, on CSF, on urine, on stool examination. We can perform laboratory examination on any tissue, fluid, cell of the body. And we can diagnose, and we can at least we can make some important indication with this pathology. So without pathology, without laboratory examination, diagnosis of disease, correct diagnosis, exact diagnosis of disease is much difficult. So this is the importance of pathology in medicine. Pathology is involved in exact diagnosis of disease. Here you can see another example to understand the pathology. So AIDS is much common disease. Hopefully everyone is aware from it. AIDS is caused by the HIV virus. HIV virus, HIV virus. How HIV virus can cause this severe disease? HIV virus binds with the receptors, a specific receptors on human T cells. Okay, binds with the human T cells, and T cells are actually our WBCs, and WBCs are our immune cells. When HIV infect T cells or bind with T cells or bind with the receptors on T cells, it causes damage in cells. So ultimately, our cell mediated immune system gets damaged. When our cell mediated immune system gets damaged, then our level of immunity, our immune system will not remain same. Our immune system uh, become low, or our immune system will not be able after AIDS, our immune system will not be able to kill even minor pathogen. So many opportunistic or many minor pathogens causes many other disease with AIDS. For example, like uh, Kaposi sarcoma is a cancer. Many opportunistic infections are also associated with, and many tumors are also associated with it. For example, a much important opportunistic infection was pneumocystic pneumonia due to pneumocystic carinae, a fungus which is an important cause of death in AIDS patient, and tumor is Kaposi sarcoma. So due to low immune system in our body and due to attack of HIV virus on our T cells, our body become more prone toward the many opportunistic and tumors. So opportunistic infections and tumors. So this is pathology. What is going on inside the cell after entrance of any causative agent? Here causative agent was HIV virus. So after entering of HIV virus, what changes occurs in our body? This is known as pathology. So hopefully now you are able to understand pathology. So let's talk about past of a slight touch from history of pathology. Around many about 300 years BC, information was collected after scientific study of internal examination of dead human bodies. Actually, internal examination of dead human body is actually autopsy. So many years ago, many thousand, many hundreds years ago, autopsies were performed, and these autopsies showed changes in human body after that. Actually scientific, first of all, scientific study was performed on the dead bodies after autopsies. What was autopsies? Autopsies were actually the taking out of tissue or cell from the dead body, and its comparison with the normal cell. Actually it was for the study of change. It was for the study of what was happened with the body, and what like in many diseases we can find many information through autopsies. In many crimes we identify changes, or in many murder cases we can identify cause of murder through autopsies. So actually the internal examination of human body or dead human bodies showed changes. These changes, first of all, these changes were seen in the dead human bodies, dead human cell, and then it was after many years it was implemented in living human tissues. For example, in living human blood, we can identify nowadays. We can identify change in living human blood. We can identify different change in values of different cells or different proteins in human body. So these changes show many important features, or many important feature of disease, or many important these actually changes or these values, change in values, help in the diagnosis of many important diseases nowadays. But first of all, it was performed on autopsies or dead human bodies. Where we were able to identify in some important changes. So now some important changes, nowadays we can identify these changes in human living human body even. So it is nowadays much we are study, we are actually living in advanced stage of pathology. Around 3000 years ago, ancient Egyptians were first civilization. They was first civilization to use the subject from religious point of view, uh, in removal and examination of internal organs. How religious point of view they actually use the mummification phenomena, mummification mechanism. So when they perform mummification on dead bodies, they usually take tissues from dead body, take out tissues from dead body and study and examine these internal organ, and they examine these internal organs. So after removal of organs, they were able to understand the changes in body, changes in organs. So from this slide you can easily understand that this branch is not is much new. Nowadays we are dealing with advanced pathology, but when was medicine discovered, when was actually medicine was when the medicine was discovered, then pathology was also associated with the medicine, because without internal examination of organs or without examination of any tissue, cell or fluid, we are unable to diagnose the disease. We can diagnose the disease without pathology with hit and trial method, but it is actually very wrong or not proper method for the diagnosis. So for proper diagnosis, pathology is also involved, and mummification actually was a religious tradition of ancient Egyptians. So they are first civilization. Nowadays, we can identify changes in human body, in cell, in tissue or in organs very easily, because we have an important instrument, an important instrument. Initially, initially it was not even discovered. Our microscope is much important instrument or scientific instrument for the study of living cell. So from now around 200 or 300 years ago it was discovered, and then after the discovery of microscope, it study of changes in cells, study of changes in cells became much easier. So it was the revolution in pathology, because after the study of changes in cellular level, now we are able to understand, now we are able to diagnose the disease more accurately, and we are ultimately able to treat many severe diseases, or many important or many chronic diseases. So, revolution in pathology is associated with the discovery of microscope, and no doubt, first microscope or initial microscope was not similar with the today's microscope, but initial idea was similar. Combination of different lenses was used to magnify the cell or tissue. So combination nowadays, we have made some modification or more modification. We have like we have we now we can change uh, light source, we can capture the images at, uh, we can change the field, we can change the light, but actually basic idea is similar with the main idea. It was the main idea was the combination use of combination of lenses. So nowadays we are using combination of lenses to magnify ourselves, to observe different changes in human cells, to identify different diseases. So now we can we are able to identify changes at cellular level. So this is actually a cellular pathology. So Rodolph Virchow, a German pathologist, studied cells by microscope first time. So it is actually a cellular pathology. Before moving forward, we should review our goal to study this subject. Ultimate goal of pathology is identification of causes of disease. First of all, there will be a single cause of any disease. There will be a couple of causes of disease, and so identification of cause of disease may help in the may help in the diagnosis of disease. Can help in the diagnosis of disease, like if it's diarrhea due to Escherichia coli, E. coli bacteria, then we can treat this we can treat this diarrhea with those antibiotics which is actually are specific for E. coli, E. coli. So cause of disease, identification of cause of disease, we can identify cause of disease through pathology. We can understand change in cell and tissue. So if we have to understand change in cell and tissue and then organ, we will take help with the pathology and help in the diagnosis of disease. Of course, when we are able to understand the change, study the change in cell and tissue, then we can diagnose the disease. And if we are able to understand the and diagnosis, or we are able to make the diagnosis correctly, then we can uh, treat, or we can uh, prevent from the disease, or we can actually minimize the spread of the disease. So diagnosis, exact or correct diagnosis is very, very necessary, uh, and it can be made with the uh, identification of changes can be performed with the and all can perform with the pathology. And all these changes or all these points are actually ultimate goal of pathology. So what is cell? Of course, you have already studied in your metric FSC or in your A or O level. So we will summarize cell or importance in importance of cell in human body. Human body is actually composed of trillions of cells. Every tissue of human body have basic component has basic component is cell. They provide structure for the body. Of course, man, after combination of trillions of cells, after combination of millions of cells, our one tissue or whole body forms. So actually, what is the purpose of, or what is the purpose of cell? They actually, for first purpose of cell is, first function of cell is they form structure of structure of body. Then cells take in nutrients from food. We usually take different foods daily, and we take different drinks daily. So these drinks or foods or even oxygen moves in our blood to the different tissues. And then different cells, these cells take in nutrients from food, convert these nutrients convert those nutrients into energy, and perform many specialized function. Those function are actually responsibility of cells. So for the performance or for the proper functioning of different cells, for the function of different cells, energy is required, and these cells took out the energy take out energy from this food. As cells also contain the body's hydrating material. This is another feature of the cell. Many cells contain our genetic material, and after during cell division, these hydrating material is much important because and can make copies of themselves. So this is actually a summary of cell. More detail you will learn about cell in physiology. Another subject, you will study the function of cell in physiology, and you will study the structure of cell in hopefully in anatomy or histology. But now I tried to summarize the cell because I am moving towards the cell injury, because before understanding or before studying cell injury, you should know about some basic things about the cell. So here is the summary of here is a diagram, general diagram of a human cell and organelles inside the cells. You can review it. I don't think so. I have to explain these organelles because in FSC you have already studied these things many times. We are without any further delay, we are moving toward our major topic. So what is cell injury? Cell injury actually is a functional and structural change, damage to the cell. What is injury? Injury is actually a change, and this change happens due to any disease, due to any bacteria, virus, fungi, parasite, trauma, and aging process. And sometimes it's cell injury is associated with the aging. Um, what is change or what is cell injury? Cell injury actually is a simply change in cell. It change may be functional or structural. So to understand the injury, when another important point is actually increased workload. Usually when increase workload on the cell, because our each cell in the body is performing specialized or specific function for our body. If workload for specific cell gets high, our cell tries to compensate the workload. To compensate the workload, our cell get uh, many different changes. So these changes are actually damage, or these changes are actually injury. So injury can be reversible and it can be irreversible, because if workload is for a very short time or a very slight increase was in workload, then our cell can move back toward its normal shape or its normal situation. But if it was a very huge and injury was very or damage was very severe, then our cell can't move toward our initial or return position. So cell damage or injury may occur due to many other causes. We will see, or we will study causes in our next slide. So before studying causes of cell injury, some common terminologies should you should know about some common terminologies, and these common terminologies are, first one is etiology. Etiology is actually a cause of basic cause, underlying cause and modifying factor. that are responsible for the initiation and progression of disease. So this is etiology. Etiological factors may be like environmental factors, or it's like bacterial, or it's like viral. So etiology actually a basic cause of disease is actually. And what is pathology? What is pathology? Pathology is actually cause and changes in human body. So and as a result of changes many symptoms appears. So these symptoms and cause is actually pathology. And if we are dealing with only cause, and we are identifying the cause of pathology, and this we will deal it in the etiology. So etiology refers to the underlying causes and modifying factors that are responsible for the initiation and progression of disease. So, what is pathogenesis? Another important term is pathogenesis, is a mechanism of disease development or mechanism of change. As we are saying, pathology is actually a study of change in the cell structure or tissue structure or organ structure. So, what is pathogenesis? Pathogenesis is a mechanism of disease development and progression. So, mechanism of change, development of change during any disease is also pathogenesis. So, what is hypoxia? Another terminology is hypoxia. Hypoxia is the deficiency of oxygen in our blood or in our organs. There are many causes of hypoxia as well. So, what is actually? I am only here dealing with the definition or under basic understanding of the terminology. So, what is hypoxia? Hypoxia is the deficiency of oxygen in our blood, in our specific tissues. So, uh, hypoxic conditions are can lead toward the many severe injuries in our body, or even it can cause permanent cell death in our body. So what is ischemia? Ischemia is actually a reduced blood supply to any part of body, to any organ or tissue of the body. And another term is aging. Aging is actually diminished ability of cells to respond to stress. It means after many years, or after a specific time period, our body cells are unable to bear specific or increased workload. And when they face increased workload, they face uh, increase in workload, these cells uh, these cells can't respond efficiently to the increased workload. Then after the increase in workload, these cells even can face death. So this is aging. Actually, what is aging? This is actually, in very simple wording, aging is badhapa. So diminished ability of cell, and the scientific definition is diminished ability of cells to respond to stress. This is actually aging process. Uh, what is apoptosis? Apoptosis, you have already studied in FSC that apoptosis is a programmed cell death. Cell activate enzymes that degrade the cell's own nuclear DNA, protein, and cytoplasmic proteins. It means if lifespan of any cell is lifespan of any cells was completed, then the presence of aged cell can is not feasible for our bodies. So removal of these cells is necessary, or aged cell is necessary. Then our cells on have programmed cell death mechanism. This is apoptosis. It means after a specific age, or after a specific times, cells face automatic death. Cells face programmed cells face programmed death. This is actually apoptosis. And another important term is necrosis. Necrosis is actually opposite to the apoptosis. Necrosis is actually accidental cell death. In necrosis, usually digestion of cell happens from inside of the cell, because many lysosomal enzymes are present in the lysosomes, in the cytoplasm of the cells. Then when lysosomal enzyme released in the cytoplasm, it can digest the cell from the interior, or accidental shedding of cell is also necrosis. So please keep in mind, these are actually very much important terminologies. These are very much important terminologies to study pathology. And in our physical start classes, we will see these terms in more detail, and we can revise these terms, but these actually are basic terms you have to understand from now, because if we are starting pathology, then you have to if we are starting pathology now, you have to understand these terms from very initial day. So these are actually basics. So another important thing is causes of cell injury. First cause of cell injury is hypoxia and ischemia. So hypoxia, which refers to the oxygen deficiency, and ischemia, which means reduced blood supply, are among the most common causes of cell injury, because both drive tissues of oxygen, and ischemia in addition results in a deficiency of essential nutrients and a buildup of toxic metabolites. Okay, because you will learn about some new reperfusion injury, oxygen reperfusion injury. So actually, due to low oxygen concentration and due to low oxygen carrying capacity by RBCs, actually these are actually basic causes of hypoxia and ischemia. And the most common cause of hypoxia is ischemia. Most common cause of hypoxia is ischemia, because reduced blood supply to any organ can cause reduced supply of oxygen. So if reduced supply of oxygen is happening, body's tissue or specific site is facing ischemia as well as hypoxia. So uh, most of time it happens due to arterial obstruction. It means if there is an obstruction in any artery, then blood movement toward the uh, next part is reduced. So obstruction is so arterial obstruction is a major cause, but oxygen deficiency also can result from inadequate oxygenation of blood. It means if you are living in environment where oxygen is deficient, or any other gas is high concentration like carbon monoxide, then carbon monoxide is have high binding capacity with RBCs than oxygen. So if carbon monoxide concentration is high in atmosphere, then it can also lead toward the hypoxia or ischemic injury. Then another cause is toxins. Another cause is toxin, and toxins are of many types: air pollutants, insecticides, carbon monoxide, asbestos, cigarette smoke, ethanol, and drugs are also toxins. So these are we are actually facing these toxins in our daily life. So with the passage of time, our cell, because it is actually like a slow poison, our cells face in our daily life, our many cells are facing many type of injury, but we are unaware from this, because our body is compensating uh, 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 our body is compensating. So another cause is infection. Another important cause of cell injury is infection due to any virus, bacteria, fungi, or parasite. They are actually microscopic, and sometimes fungi is actually can be seen with the naked eye, but actually basically the microscopic structure, viruses, bacteria, fungi, parasites can kill, can destroy our cell, can cause change in our cell. So infectious agent, these are infectious agent, they can produce many types, and many bacteria can produce toxins, and few fungi can produce even toxins. So they can cause change in cell, through they can cause change in cell through toxin production, or even destruction, or many other mechanism. So with many other mechanisms, so their infectious agents are also involved in the, or also major cause of cell injury. Then immunological reactions, autoimmune diseases. Our immune system is actually responsible for the prevention, is actually responsible for the protection of our body from infectious agent, but sometime our immune system reacts with our own body, against our own body, like in many diseases, antibodies or immune cell or specific immunity develops against many disease, against a specific disease. But the immune cell, the developed immune cell, or antibodies, also kills the also kill the our own body tissue. So damage due to uh, our immune cells, or our body or immune system, this is actually immunological reaction. So many immunological reactions are also involved in cell injury. Genetic abnormalities are also much important uh, in study of cell injury, because mutations in genes can cause expression of many abnormal proteins, or due to translation of many mutated genes, or expression of many mutated genes. Our body faced many type of injuries. There are many genetic diseases in our area, so you can understand easily. Then abnormal cell division, due to mutations, abnormal cell division usually occurs. So this is actually is genetic abnormality. Nutritional imbalance, poor nutrition or malnutrition, or low protein or low calorie content, even per day, can cause damage in our cells. So dieting is a good habit, if you if you are overweight. But if you are not overweight, so it can lead toward the deficiency or malnutrition, and it can lead toward the even cell injury or cell death. So physical agents are also important factor, like trauma, extreme of temperatures, radiations, electric shocks, sudden change in atmospheric pressures. They can cause minor to severe cell injury, but are much important in our routine life, because many roadside accidents happens daily. So so after roadside accident, many s- damages, like bone get like many type of damage occurs, like skin, or skin damage, bone breakage. These are actually all are example of cell injury, and all these physical agents can damage our cell. Aging is actually a cellular senescence result in a diminished ability. But I have already told you that कि जब सेल की एज सेल में डिवीजन की कैपेसिटी ख़त्म हो जाती है, देन सेल स्ट्रेस और वर्कलोड को बेयर नहीं कर पाता. जब सेल स्ट्रेस और वर्कलोड को एफिशिएंटली बेयर नहीं कर पाता, देन द increase in workload can lead towards the death of this cell. This is actually aging process. So what is summary of the cell? The scientific we define the pathology, functional structural changes, study of functional and structural changes, and then we defined cell is a structural and functional unit of life. We studied the function of major function of cell. Then we have studied the damage or cell injury, and then we have studied about the important causes of cell injury: hypoxia, ischemia, nutritional deficiency, infectious agent, immunological reactions, genetic abnormalities, physical agents, and aging are much important factors in cell injury. So this subject is actually very easy and is interesting. First of all, you should simply know about the pathology. You should not deal with the advancement. You should not deal with the uh, why injuries happening, how injuries happening, what are changes. With the passage of time, you will learn everything. But now you have to understand some basic things or some initial things. I will deliver my lecture in Urdu as well in our physical classes or in our Zoom classes. Okay, then you will be able to understand pathology easily. But here you have to understand the pathology from basics. So, good luck for your subject, or good luck for your future. And at the end, welcome you all in College of Allied Health Sciences, Akhtar Said Medical College. College is actually, we have two positions from nutrition in University of Health Sciences, and we are expecting more position in our our previous batch. So you can all students are equal. All students are able to score high in UHS. But exam details are not important in first lecture or introduction. We will deal with the detail of subject, or how we can easily cover this subject. We will see these things in our physical classes, or in our next lectures. But nowadays you have to take or you have to try to understand this subject as much you can. So basic things, basic terminologies are much important for you. So again, you are welcome in a very good system. You then I should say कि आप लोग जो है यहाँ आपको बहुत जो है हर लिहाज से आपको बहुत ज़्यादा सपोर्ट किया जाएगा. आपको आपके सब्जेक्ट, आपके फ्यूचर के बारे में जो भी गाइडलाइंस चाहिए होंगे, आपके पास टीचर्स हैं, आपके पास फैकल्टी मेंबर्स होंगे. जो आप लोगों को प्रोवाइड करेंगे। आप लोगों के पास जो जो आप लोगों की क्यूरीज होंगी अपने फील्ड से रिलेटेड, अपने सब्जेक्ट से रिलेटेड, वो आप लोगों को बताए जाएंगे। सो डोंट वरी एट ऑल, आप इस सब्जेक्ट को पढ़ें। जो जो चेंजेस, जो जो क्यूरीज आपको इस लेक्चर और सब्जेक्ट में हुई, बेफिक्र रहें, वो आप लोगों की सब के क्वेश्चंस और आंसर्स दिए जाएंगे। ठीक है, आप व्हाट्सएप पर मैसेज कर सकते हैं। इसके अलावा जो है इंशाल्लाह सून हम जूम के सेशन भी करेंगे, वहाँ पर भी हम स्टडी करेंगे। हम डिफरेंट वे से स्टडीज़ करेंगे। ये एक वे नहीं है, हम डिफरेंट वेज से स्टडीज़ करेंगे। जब डिफरेंट वे से स्टडी करेंगे तो वो लोग जिनको अभी ये लेक्चर इजीली समझ नहीं आएगा, फर्स्ट ऑफ ऑल जब आप इस सब्जेक्ट को एक लेक्चर को बार बार सुनेंगे तो आपको समझ आ जाएगा। लेकिन अगर कोई होता है कि चूंकि न्यू सब्जेक्ट है तो उसे डिफ़िकल्टी होती है, देन हम इसको जब डिफरेंट वे से कवर करेंगे देन आपके लिए ये आसान होगा पढ़ना। सो thank you so much, and enjoy your university life, and welcome in Akhtar Said Medical and Dental College. Thank you.